Welcome. Welcome, my dear friends. Myself, Professor Dr. Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that in this my channel, I am preparing the videos for the medical students, for the upcoming doctors, for the professors, and also for the patients. This particular serial is based on Ashtang Hruday Sutrasthana. I am discussing Ashtang Hruday Sutrasthana from chapter number 1 to chapter number 30. But to make a task very happy and healthy, I am dividing each chapter in different sections so that it will be easy to understand, it will be easy to remember. So in this chapter number 4, this chapter is divided into 4 videos. Try to understand. Each chapter is break up in different videos. So I request all of you, please check that you have seen each chapter and each part of that particular chapter. My dear friends, I have already uploaded Ashtanga Hruday Sutrasthan, chapter number 1, chapter number 2, chapter number 3, and chapter number now 4 is already started. So today, Ashtanga Hruday Sutrasthan, chapter 4, Rogan Anutpadaniya Adhya, part 1. Very interesting chapter. Ashtanga Hruday is well-known Samhita of Ayurveda, famous not only in India, but all over the world, among the students, among the practitioners, and even among the patient. This chapter is very helpful for even a common layman. He should understand that if that particular person wants to prevent from any disease, he wants to remain healthy, then he must follow this particular title, Rogan Anutpadaniya. Roga means diseases, Utpadana means creation, and Anutpadana. That means you don't want any disease. Then you should not suppress your natural urges. This is the tag sentence, hashtag of this particular chapter. Myself is Professor Dr. Rajendra Raghuvir Deshpande. I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For communication, my WhatsApp number is 922681060. So let us move further. In this chapter number 4, Ashtanga Hruday Sutrasthan, Rogan Anutpadaniya Adhyaya, part 1, we will discuss very small attempt from Shloka number 1 to Shloka number 8 only. Okay. Ataha Roga Anutpadaniyam Adhyayam Vi Akyasyamaha. This is the speciality of my serial. Professor Dr. Rajendra Deshpande's Ashtanga Hruday serial is very popular, will be very popular because each shlok that I have given with Sandhi Vigraha. Try to understand. Sandhi Vigraha of shlok is very easy for understanding purpose. This is the only channel, this is the only video that you will get Sandhi Vigraha of Ashtanga Hruday Sutrasthan. Okay, if anybody wants the Ashtanga Hruday Buti with Sandhi Vigraha, that is PDF file is available with me. You can WhatsApp me, but this is a paid. All my services other than YouTube channel are, sorry to say, but paid services. Itihasma ahu atreya adeyaha maharshayaha. After Rutu Charya Adhyaya, seasonal regimen, Acharya Vagbhat explained the chapter Roga Anutpadaniyam. Very interesting. Prevention is better than cure. So this is regarding prevention of diseases. Thus said Atreya and other great sages. So in each video, this is also speciality. You will see the different videos of Ashtanga Hruday. But Dr. Deshpande has explaining in a very lucid and simple language of English, which is all over the world, everybody can understand. I am giving the shlokas with Sandhi Vigraha, and also in each video, I am giving you important questions for first year BAMS students for their examination purpose. Also MD in Samhita Siddhanta department. Am I right? So LAQ, long answer question, 15 marks. Describe Roga Anutpadaniya Adhyaya, total chapter. In short, you have to write in the examination. So each 4 part is very important from my video. Explained. Vegavrodhajanya Vyadhi. Vega avarodha. Vega means natural instinct. natural urge. If I want to go for urination, if I want for going to defecation, then you should go immediately because natural instincts. And if I suppress my urination, if I suppress my defecation, that can create a lot of problems. That is, Vega means natural urge, natural instinct. समझ रहे ना आप? तो वेगावरोधजन्य व्याधि diseases and the चिकित्सा, that is management. Explain सूत्र संस्कृत वेगान धारयेत वात विट मूत्र. Vit means stools, STOOL. Mutra means urine. Short answer question, 3 or 5 marks, right. Mutra अवरोधजन्य लक्षण और उनकी चिकित्सा. If you suppress urination repeatedly, frequently, what will happen? Mal defecation reflex. If you suppress for many days, many months, many years, that can affect your body. So avarodh, obstruction, lakshana, features, symptoms, and unki chikitsa, management. Kshudha, hunger. If I feel hungry, I should eat. Pitta people have more hunger. Kapha people, less hunger. Trishna, when I am feeling thirsty, I should drink the water. And Nidra, sleep. If I want to go to sleep, I must sleep. These are the natural urges. What will happen if I suppress and how it should be treated? Content of this chapter. In the present chapter, Vagbhatta stressed that all the diseases will be manifested due to forceful expulsion. Veg udirana. If I am not getting the normal stool, straining while passing the stool is not correct. Udirana, Veg udirana, and voluntary suppression, Vega vidharana, both the things are bad. Vega udirana and Vega vidharana. Two terms are different. One is forceful expulsion, another is a voluntary suppression. Both the things are not natural. How to prevent the diseases? Hence, for the prevention of diseases, one should not suppress the natural urges, that is Sharira Vega. Physical urges like urination, defecation, ejaculation of semen, etc. And suppress the urges. There is another group. There is not another group, one at physical level and another at mental level. There is also some urges, desires in your mind. But Ayurveda says, Vagbhatta is saying, Ashtang Hruday is saying, yeah, mental bad thoughts should be controlled. This is Dharaniya Vega. Control, Dharaniya Vega. And physical urges, Na Vegan Dharaniya. Na Dharaniya. Suppress the urges. It is not actually suppress, it is a controlling. Word is different. Control. Dharaniya Vega. Manasa Vega retains to rashness, angry, and evil deeds, physically, mentally, and orally, that should be always controlled. You should try to control your mind activities. Remember this sentence. These urges are of two types. Dharaniya Vega. These are Shadaripu, Kama, Krodha, Lobha, Moha, Madamatsara. Control, suppressible, controllable urges, and adharaniya Vega, urination, defecation, non-suppressible urges. So, Ashtang Hruday, Sutrasthana, chapter 4, part 1, very important shloka. Vega avarodha tyag. Vega na dharayet. Vat, vit, mutra, kshava, trit, shudham. Nidra, kas, shrama, shwas, jrumbha, ashru, chardi, retasam. Vat, flatus. Vit, stools. Mutra, urination. Kshavatu, sneezing. Okay. Trut, desire to drink the water. Shudha, okay. Hunger. Nidra, seventh, sleep. Kas, then shrama, exertion, lot of exertion, and I want to take rest. Take the rest. Shwas, control. Don't be too exhausted for yourself. Jumba, don't suppress it immediately. Ashru, Tears, don't suppress it. Open your mind, open your mind. Chardi, vomiting, and retasam, ejaculation. Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14 Vegas, not to be controlled. So, Dharaniya Vegas, these should be controlled, mental activities. For example, Lobh, greed, you must control your greed. Shok, grief, Bhaya, fear, Krodh, anger. Then Man, egoistic. You should control it. Okay. Then Nirlajja, shamelessness. You should shame about some bad things. Okay. Irsha, jealousy. Atirag, too much attachment for your property, for your money, for your bungalow, for your family. Too much attachment is bad. Okay. Parusha Vachana, extremely harsh words. Try to avoid, try to control. Then Anita Vachana, that is lying, cheating to an. Then Parapida, physical handling. These activities should be very carefully restrained mentally, orally, and physically. Okay. Adharaniya Veg, non-suppressible urges, Vata, that is flatus, Vit, that is feces, fecal matter, defecation, Mutra, urination, then Kshavathu, sneezing, Trit, thirst, Shudha, that is hunger, Nidra, that is sleep, Kas, that is cough, then Shramashwas, dyspnea on exertion, okay, Jrumbha, yawning, Ashru, tears, Chardi, vomiting, and Retasam, that is a semen. These should not be suppressed, and it is necessary that the needs of these natural urges are satisfied immediately. That is, as soon as they come up, you should perform that particular act of urination or defecation. Maximum importance you should give for urination reflex and the defecation reflex. These are very, very important for the practice. Adhovata, that is flatus. Vegavrodhajanya Vyadhi, Adhovayu. Adhovatasya rodhena. Gulma, Udavarta, Ruk, Klamaha, Vat, Mutra, Shakrut, Sangaha, Drishti, Agni, Vadh, Rit, Gadaha. So that is Gulma. Abdominal tumor, that is gaseous distension. Udavarta, upward movement of Vata, that is antiperistalsis. Ruk Vedana, that is pain in abdomen, spasmodic pain or intestinal colic when there is a tremendous gas and is not passed, then that is a colic. Klama, that is debility, tiredness without exertion. There is difference in Shrama and Klama. Klama is tiredness without exertion. Klama, tiredness without exertion. Remember this specific terminology of Ayurveda. Klama, it is always asked in the examination. What is the difference in klama and the thakan? इसमें क्या फर्क है? Vat sang, mutra sang, shakrut sang. Sang, that is retention of fecal matter, retention of urine, retention of the flatus. These are the problems if you suppress the flatus. Okay. Next, drishti vadh, loss of vision, that is giddiness due to the colicky pain. It is not related with the eyes. You will not blind. Remember this thing. Agni vadh, that is mandagni, decreased digestive power. Then hridagad, diseases of the heart, heaviness in the chest, especially because of the back pressure from the gas, chest pain. These all will be caused due to the suppression of adhovata, that is flatus. What can be the treatment? Sneha Sveda Vidhi. Tatra Vartayo Bhojanani cha Panani Bastya cha Eva Shastam Vata Anulomanam. Vata Anulomana Chikitsa. Oleation. Sneha means use some lubricating material, ghee or the oil. Fermentation. Svedana. Then food and beverages which are Vata Anulomana, drinking warm water. Very useful. Basti, that is medicated animata. Anuvasana basti, warm sesame oil, 60 ml per rectum. Next, second, Shakrut, that is fecal matter, defecation reflex. Shakrutaha Pindika Udveshta Pratishaya Shiroruja Urdhvayu Parakarto Hrudayasya Upravodhanam. Can you see my cursor? Yes. Mukhena Vit Pravrutti cha Purvoktaha cha Amayaha Smrutaha. Amaya means diseases. Okay. Cha means and. First is Pindiko Dveshtan, twisting pain or cramps in the calf muscle. Pindiko Dveshtana, very important term. Okay. Pratishaya, always complaining of cold. So henceforth, any patient comes to you for chronic coryza, continuous, I am suffering frequently cold, ask him whether he has a habit of obstruction, of controlling the defecation reflex, suppressing the defecation reflex, that can be the problem. Then Shiroruja, this is very common. If the patient comes to you for a migraine attack, always ask him whether he has a habit of suppressing the natural defecation reflex, because this is the root cause mentioned by Ayurveda in Ashtang Hruday by Vagabhat. Okay. Then Udavarta, upward movement of Vata. Then Hrudaya Uparodha, that is suppression in the region of heart, because of the gas. Then Mukhena Vit Pravrutti, fecal coming from the mouth. This is extremely rare, or I can say it cannot be practically seen in any cases. Okay, but Bhagavad has told you the case of acute abdomen, total intestinal obstruction, the case of total intestinal obstruction, that in that case, these particular things may happen, but it is practically never seen. I have never seen that Mukhena Vit Pravrutti. Okay. These are the signs and symptoms caused due to the suppression of urge of feces, along with the diseases mentioned earlier in respect of suppression of flatus. Do you understand? Previous all diseases and disease addition. Purvokta cha amayaha. Now next vega, mutra, urination, angabhangaha, ashmari, basti, medra, vankshana, vedanaha, mutrasya rodhat purvecha, prayo rogaha tad aushadham. Due to the suppression of urge of the urination, what can happen? Angabhanga, splitting pain all over the body. Ashmari, if this habit is a long term, years together, the patient is suppressing the urination, it may get what you can say the concentration of urine, Kshara Dravya will be deposited and calculus can be formed. Okay, calculus can be developed because of this particular bad habit of suppression of urination. Okay, so whenever the patient comes to you of urinary colic, renal colic with renal stone, urinary stone, what you should ask, whether you have the bad habit of suppression of urination. Okay, then Vasti Vedana, Medra Vedana. Vedana means pain, and Vankshana Vedana. So pain in the bladder, pain in the penis, urethra, and pain in the groin region. And also the diseases mentioned in respect of suppression of flatus and suppression of stool will be added in this particular problem of suppression of urination. Treatment for all these conditions, suppression of flatus, suppression of feces, suppression of urine, what will be the treatment? Vagabhat, Ashtang Hruday Sutrasthana. Varti, Abhyanga, Avagahacha, Svedanam, Basti Karmacha, Annapanam cha Vidabhedi, Vidrodhotheshu Yakshmasu. Sandhi Vigraha. Dr. Deshpande is giving Sandhi Vigraha of each shloka. Varti or the Phalavarti, that is rectal suppository, can be given. Okay. Then Abhyanga, full body oil massage, because this is Vata problem. Obstruction is a Vata problem. Then Avagaha, sits bath. Okay. Svedana, sudation, fomentation. Basti karma, medicated enema. So are the best treatments indicated for the management of diseases caused due to suppression of flatus, suppression of fecal, defecation suppression. Defecation reflex is suppressed, and urination reflex is suppressed for months together, years together. Then these symptoms can arise. Okay. Even this can arise, even you suppress for only one time. You want to go to urination and you are not going because of you are traveling somewhere. Then this angabhanga can also occur. There you may not get the ashmari, but angabhanga, vedana in the urethra, pain in the urethra, pain in the groin, that can happen even acutely. So some symptoms can be seen after a long period and some symptoms can be seen immediately. What you should do? Special food and drinks which eliminates the obstructed feces is to be given in the diseased condition due to the suppression of feces. Treatment for suppression of flatus, suppression of feces, and suppression of urine. Mutrajeshu tupanecha pragbhaktam shasyate ghritam. Medicated ghee is the best for suppression of urination. Urine problem, always medicated ghee. Okay. Jiranam antikam cha uttamaya matraya yojana dvayam. Avapidakam etaccha saudnitam dharanat punaha. In the diseases due to suppression of urine, medicated ghee is to be given internally before food and after the digestion of food in a quantity of minimum and maximum doses respectively. The method of administration of medicated ghee is known as avapidaka. Okay. So, my dear friends, this is all about today's video, chapter 4, Rogan Anutpadaniya Adhya, part 1 that we have completed from Shloka number 1 to Shloka number 8. Small every time. So, thank you very much and I request all of you, please like this video, share this video and don't forget to subscribe my YouTube channel. For paid online consultation or paid teaching programs, you can always WhatsApp me on 92268 10630. So my dear friends, I wish you all the best and bye-bye.